うんうんうんうんうん
Oh, amen, amen, amen. Are you there? Amen. I need oh, hello. Amen. Amen. please answer and then, anybody want to host tonight? Ahmed, are you there? Louis, Louis, can anybody hear me?
Hello, John.
Hey,
How
Louis,
are
what
you?
are you doing?
Yeah, I'm here.
Listen, can you host? Can you host?
I'm sorry.
Can you host and introduce Dr. Kato?
Oh, maybe Dr. Salazar will be able to host.
Okay, who else wants to host?
I don't
Because
know.
I'm in a bad spot.
This com this meeting is with the Young Neurosurgeon Committee of the World Federation. Maybe he
Okay.
must.
Is Ahmed here?
He should be here. Where is he now? What time is Miami now?
We started in 10 minutes.
Yeah. Now in Curitiba it's very cold. Now it's 10 p.m. Saturday night.
Yeah, that's right, Brazil.
Yeah, for you it's hot. Yeah.
You're looking bright and bushy tailed. Is my sound, is it okay? Is it audible?
It's okay.
It's okay?
Yeah, can you hear me?
Yeah, I can hear you fine.
Okay, good.
Oh, hold on.
Hi, John.
Hey, Bob.
Hi, how are you? Long time. Professor
All right.
Kato, hello.
Kato.
How are you?
Hi, Baron. How are you?
Good.
Fine,
Long
fine. Thank
time
you.
no
Thank you so
see.
much for being here with us. Thank you so much. Professor Borba, good night.
Hello, good evening. Good morning, Professor Kato.
Hi, good morning. Good evening.
How
How are
are
you, everyone?
you?
Hi,
Fine.
hi. Everything fine
Good.
for you?
Yeah, everything is perfect. Good,
As a
good
as a
to see you
president
here.
work. Yeah.
Yeah,
Everything good?
working a lot.
Yeah. Okay,
Okay.
okay. So
Are you
you are
okay?
from Brazil or you are from where?
I'm in
Where
Brazil
are you
now.
now? Brazil?
I'm in Brazil now.
Okay, it's very
And
lucky for
Tuesday,
you.
Tuesday you go to Mumbai. You'll be there?
Oh, yes, yes. I'll be there. Yes.
Excellent,
See you there.
excellent. You'll meet you
See you
there.
there.
Excellent.
Yes, yes. Hi.
Okay,
Okay.
excellent. Okay, good.
So
Good to see these young people here. Now Brazil is 10 p.m. Saturday night. Imagine.
mm. Japan is good time. Is just 10 o'clock in the morning.
Yeah, it's okay. It's okay. Good. Hola, Byron, ¿cómo está? ¿Todo bien?
¿Qué tal, profesor? Bien, bien, todo muy bien.
Sí. Good, good, good.
Esperando que se conecten un poquito.
Bueno, bueno, listo. Yo voy a empezar y tengo que salir, ¿no? Sí.
Sí, sí, tranquilo, profe. Sin problema.
Hi, John. How are you? Long time no see. Thank you very much for your long time.
No, thank you,
Long-lasting.
Professor Kato. We always
Hi, hi. How are
like
you?
everything, all the efforts that you do to help us, to the global community. So we're delighted to have you with us.
Thanks. Just my presentation, not so long, but I think, I hope we
Yes, yes,
can,
you can have all the time you need. Don't
yeah,
worry.
thanks. Thanks.
Ahmed, how are you, my friend?
Hi there, Professor. Welcome all. Now it's 4 a.m., so it's very early for me.
Oh, I'm
And
sorry. I'm sorry for
It's
yeah,
that.
good, good. Wake up early is good.
hi, dear Professor.
How are you?
Hi, how
Good.
are you?
I'm,
How are
I'm
you?
Good
good.
to see
Thanks.
you.
Hello, you're going to moderate, okay? And then
Sorry.
you're going to moderate, okay?
Professor Byron Salazar will moderate the session.
Who?
Professor Byron
I
Salazar.
don't.
Byron Salazar.
I will, John.
Yeah. He is the
Okay,
chair of the
well,
committee.
I'll introduce you, Ahmed, and you can introduce who you want, okay?
Okay,
Mm,
perfect.
okay. If Professor permit me, I will go ahead.
Uh, okay, recommend. Okay, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good evening, Dr. John, broadcasting from Miami Beach. We have the pleasure of having one of the finest teachers and mentors in the world, and we'll have Ned Al-Ghamidi from Yemen, also educator. He's going to run the show. Okay, Ned, welcome.
Hi, dear all. Thank you, dear John, for this opportunity. Uh, uh, here's Dr. Ahmed Al-Ghanimi, the Asia representative in the Young Students Committee of WFNS. It's my privilege and honor to welcome all the attendees, especially Professor Luis Barba, Professor Yoko Kato, and Professor Baron Salazar. So, on behalf of WFNS, we are so glad to have Professor Yoko Kato with us today. Now, I will give mic to Professor Baron Salazar to welcome Professor Yoko Kato.
Thank you, Ahmed. First of all, I would like to thank Neurosurgical TV and John Bennett, of course, Ahmed Aganemi, and all the members of the WFNS Young Neurosurgeons Committee for the organization of this webinar. As you know, the WFNS is dedicated to supporting the professional growth and development of this next generation of neurosurgeons worldwide. So I guess it's our mission to promote the excellence in neurosurgical education, foster international collaboration, also encourage research, innovation, and of course, create opportunities to mentorship and leadership among young neurosurgeons. So I guess by strengthening the global networks and facilitating the exchange of knowledge and experience, this committee aims to improve neurosurgical care and also contribute to the advancement of the specialty of the benefits of patients. So before starting, I would like to present our dearest and well-renowned WFNS president, Professor Luis Borba, to give us some encouraging words of wisdom before I can present Professor Yoko Kato. Professor Borba, go ahead.
Okay, Byron. I don't know. Can you hear me? Can you
Yes.
hear me okay? It's a great pleasure to be here with you this Saturday night here in my city, Curitiba. It's very cold today. Now it's 3 degrees centigrade outside, but we are here have a hot time with Professor Kato. No better than Professor Yoko Kato to talk to the young generation. Her work during many, many years to help and to promote the education in Asia, but around the world is undisputable. Nobody did for the young generation, young neurosurgeon, more than Professor Yoko Kato. And his word and her words will make the difference for these young people from South Asia, Latin America, and the whole world. I'm very pleased to be here tonight to listen Professor Kato. Her knowledge, her wisdom will improve and will inspire a lot of young neurosurgeons and medical students. Maybe not online now, but this is recording and you can listen and understand her philosophy and the way that she helped a lot of people. Professor Kato, thank you very much for everything that we did, is still doing, and you do more for the young neurosurgery and for the neurosurgery, inspiring these people to keep working and treat and see the patient. Thank you, Byron, and thank you and Ahmed for this initiative to bring our leader, Professor Kato, to give this webinar and give this speech. Thank you very much. And Byron, please
Thank you, Professor
go
Borman.
ahead and Professor Kato. Thank you.
Thank you. It's, as you know, it's my pleasure for all of us to introduce Professor Yoko Kato. She is an internationally acclaimed neurosurgeon. She's a pioneer in cerebrovascular and school-based neurosurgery. She's widely recognized for her exceptional expertise in microsurgical treatment of cerebral aneurysms, AVMs, and other complex vascular disorders. So, over the course of her distinguished career, she has performed more than 1,800 aneurysm surgeries and has made significant contributions of advanced neurosurgical techniques and improvement of patient outcomes. She has also played a leading role in neurosurgical education, as Professor Borba said, and international collaboration, mentoring generations of neurosurgeons from across Asia, around the world. So she has also a strong advocate for women in medicine. She founded the Women's Neurosurgical Association in Japan and the Asian Women's Neurosurgical Association, fostering professional development, leadership opportunities for female neurosurgeons. And her outstanding achievements have been recognized with numerous national and international honors, including the WFNS Medal of Honor and the American Association of Neurological Surgeons International Lifetime Recognition. She's the actual president of the Asian Congress of Neurosurgical Surgeons, winner of the prestigious William Scoville Award from the WFNS at the annual conference held in Dubai. She's also a member of the ONCE Academy, author of hundreds of scientific papers, and a researcher. So, Professor Kato, I think your career exemplifies excellence in clinical practice, scientific innovation, education, and global leadership in neurosurgery. Please go ahead. The floor is all yours.
Thank you very much. So, Mr. President Luis Bulba, thank you very much for your nice word. Maybe too much for me, I think. Always, my philosophy is just happy working and to make friends and to make colleagues. That is my philosophy. So always happy working is most important, not only the neurosurgeon, but also as a human, I think. So that is my concept. Then I will share my slides. So today is the topic is just beautiful along the neurosurgical journey. So the lesson for the medical student from life in neurosurgery, I think. So long time, maybe you will take to become a good neurosurgeon or a good human, I think. So I think every meaningful the journey has a difficult turns. So the journey that has warning signs. So the medical student, resident, the neurosurgeon, and the expert and mentor and leader. So during that time, maybe the 40, 50 years, so everybody has experienced so many feeling. So that the fear and the comparison and the ego and failure and uh, burnout. And, like, sorry, and loss of purpose. So I think during our life, so the challenge is not to avoid every obstacle. It is to learn how to move through them. So those things is very natural, not only for you, I think. So don't be afraid. So am I good enough? Then maybe you can ask yourself, I think. Medical students may think the neurosurgery is too difficult. I am not talented enough. The training is too long. Can I really do this? I think when I feedback my life, I never think such those things. This is maybe the current concept when they come up in your mind, I think. But I think that neurosurgery is not different from other subjects, I think. Every subject is the same. Once you love the neurosurgery, I think that is nothing. Maybe Professor Bolbert, he is a role model of us, I think. So passion plus and persistence. So perfect at the beginning. You do not need to be extraordinary to begin. You become the extraordinary through the journey. So your journey is not their journey, I think. So the path A comes to the path B. It's a long way. So the different speed, so different turns, and the same purpose, but finally. So compare yourself with who you were yesterday, not with someone else today. So just you can think about your journey, only your journey. No need to think about others. Just you can focus at your age, I think. Just you can focus on your purpose. That is very important. So a great surgeon is more than hands, of course. More but he knows everything, I think. So a great neurosurgeon, not a great technique. Instead, the knowledge, technical skill, judgment, communication, compassion, integrity. So many things is behind us, behind the techniques. So when we treat a patient, of course, the surgery is the most important factor. But behind, I think we need so many important points as a doctor. My feeling is, of course, many things, but I think always taking care of the family. The family is another important factor, I think, to tell them. So what kind of the surgery you will be going to have your relatives. So repeated the explanation is very important. Knowing when not to operate may require more wisdom than knowledge how to operate. So that is one point. So success can become dangerous. So sometimes, of course, the learnings succeed gains confidence and overconfidence. We can step to 1 to 4 sometimes. So yesterday's success does not guarantee tomorrow's outcome. So that today's success is very important and satisfy good satisfaction of your mind and also of your skills. The three protections against ego. So listen to your team. The second is question yourself. The third, respect every case. So this is very fundamental. The three protections how we can overcome ego. So not every operation has a perfect ending. So complications happen. Papers get rejected. Exams are failed. Plans do not always work. So the most difficult cases in my career, they were sometimes my greatest teachers. So we can learn so many things, our failures. So the never hide from a mistake, learn enough from it. That is that changes how you practice. So that is a kind of the circle. The failure, reflect, learn, change, again the failure, the same circle. So that is the your life. So neurosurgery is never sole performance. So recently, we treat the patient with so many colleagues. A neurosurgeon, of course, anesthesiologist, radiologist, neurologist, nurses, technologists, and also the rehabilitation. And you don't forget about the family who supports the patient behind the patient. So asking for help is not the weakness. Knowing when you need help is wisdom. I think when you meet the patient has so many potential teams in future the treatment, I think. So as a doctor, we ask so many team members to success the save their life. A long career requires a sustainable life. Work-life balance may not always be perfect, but the work-life integration must be intentional. So I think quite maybe the difficult when you become a neurosurgeon work-life balance. But it's getting maybe reach I think at this time. Otherwise, I think DEI, they, of course, diversity, so many things is cannot satisfy. So Steve, that health and family, so those things support your psychological motivation to treat the patient. So reflection and ask for the help. So medicine is a marathon, not a sprint. So of course, marathon never give up. Whatever you experienced during your journey. So of course, the sprint is another important factor. Of course, when you do the surgery, when you do some activity during the treatment of the patient. So from the pitfall to listen, the goal is not to avoid difficulty. It is to become the truth. So fear of the difficulty, be courageous. And comparing yourself, follow your own path. And technical skill is a develop judgment and humanity. And ego is to stay humble. And fear of the failure, the learn and grow. So those things is very, very important. So I think work as identity to protect what matters, and burnout is a make your career sustainable. And chasing the title, choose the purpose, and forgetting to give back, lift the others. Lift others is really important. So you can lift with your colleagues, not only you. It's very important. Courage, humility, and resilience, and purpose, and legacy. So you are choosing more than a career. So you're choosing the person that you will become along the way. So be a good student, or before become a good doctor. Be a good doctor, before becoming a great surgeon. So be a good human being through every stage of the journey. To make your journey the meaning. So that every day is very important. You not think about the future, even the 1 month or 1 year ahead. So just you can do perfect hour. That only that day is very, very important. So I think it's very, very short, my presentation, but I think, of course, I would like to talk about maybe the next time is the women in neurosurgery. I think how we can encourage them. So I don't want to say the male and female, or resident or doctor. So the make no difference. The position is as a senior. I think it's very important to make them give them some encouragement. So thank you very much for my presentation. Thank you.
Thank you so much, Professor Kato. I think we are glad to see your philosophy, how you have reached, the top standards of the field. And I would like to hear something from Professor Borba, which is also a person that has your interest, of teaching everyone to share his knowledge with everyone. I guess that what makes you too, one of the best neurosurgeons, not only in the world, in the practical, in the skill setup, but in the human factor. So, Professor Borba, if you have any comment about your experience to reach this success, to share this knowledge with the people, how would you like to tell us?
You know, I didn't expect more than I just hear. This presentation didn't touch just my mind, but my heart. What Professor Kato showed, what I 100% believe. You make your future. In one very important issue that you every day you learn. If you're a medical student, you want to be any kind of profession, want to be a neurosurgeon, want to be cardiac surgeon, or any kind of profession, if you are a human being. First, we need commitment. We need focus. We need determination. But the most important, you need to be happy. Because you decide for this career, for your life, you need to be happy. And every day you are learning something. And be humble that you are not God, The people say the neurosurgeons are seem close to God. Of course not. We need to learn everything. Have your mind open. We are learning with everyone. This makes the difference in life. Our professor put in words, it's what you really think. Because this Yoko Kato is Yoko Kato. Because she expressed to us in this presentation what the medical student need to know. Not about the cranial nerve, the skull-based approach, need to know what you really want for your life. This is the difference. And who make your future? Yourself. You build your future. The way that you behave, the open mind that you have, the way that you do it. No better than Professor Kato that has her entire life dedicate to educate, to help, to talk for these people, for the young generation. It's recorded, yes, Byron.
Yes, I guess it is. I hope it is, John. I don't know.
This presentation has to be spread worldwide. John, please give me the record to put in the website and spread to the World Federation Young Neurosurgeon around the world. We don't need people that come here to talk about anatomy of the cavernous sinus, skull-based approach. We need people talk like this, to talk of the heart of the people. This will make the difference when they decide to do any kind of profession, especially neurosurgery. I think in Japan are 7 years training, in US 7 years training, in Brazil 5 years training. You decide to dedicate your life to help the people, to be as a neurosurgeon, as a doctor. I think that I always say, before to be a surgeon, need to be a doctor. But before to be a doctor, you need to be a human being. Say you are treating people to save lives. It's not business. Medicine is not business. Our business is help the people from different ways. From surgery, from clinic, or just talk, or just listen to the patient. Sometimes when you listen to the patient, you help much more than do any kind of procedures. And only Professor Kato can say that, because her life express it. I know your job, Professor. I know what you did for many, many young neurosurgeons, young medical doctors. Thank you to be with us in this not short presentation. You went to the point, went to the heart of us. Now it's 11 p.m. in Brazil. I'm very happy to be awake. I'm very happy Saturday night to be here. Byron, you make a great job. Ahmed, a great job. I see
Just one word too,
Jose Valerio
Boba.
here. You see. Thank you very much to be here, sir. Thank you.
Thank you, Bob.
Please.
Thank you, Boba. Thank you very much for your nice word, I think. So I know the Professor Bulba that since he was young, I think. I met him in United States, some workshop. So since that time, I think he experienced so many encountered failures. So during that the experiences, that I think that he became a very strong, kind of a strongest the person I think that he became. So I think for your the resident or the young doctors, I want to say once again, don't be afraid the failure or sometimes not going well. I think that makes you strong. I think so you can experience as many as possible in your that residency time. I think very important.
Yeah.
Thank you very much, Boba,
Professor,
for
thank you.
this chance.
In neurosurgery, we learn every day. Every case is different. I always say the neurosurgery is the only specialty that you can leave in the morning smiling and come back crying. It's the only specialty you can do that. But you need dedication, commitment, and focus. It's make the neurosurgery different. We are not different because we are treated the central, the brain, this kind. You need to be different in your behavior, the way that you see. Thank you, Professor. We will follow you.
Thank you. Thank you very much.
20 years I'm follow you. More than 25 years follow you. Thank you very much. Jose Valerio, see Valerio here is the chairman of our neuro-oncology committee. He's a very bright guy that working 24 hours, have a very good mind.
Right.
Byron, and please go ahead and follow.
Yes,
Thank you, Professor. Thank you, Professor Borba, Professor Kato. It's always a pleasure to hear from you, from your experiences, from your way that you have behaved all these years. And actually, you are a mentor for all of us, the young neurosurgeons. We are in the way to get to your level, and we are, learning a lot how to be humble, how to do things, how to properly act, and of course, as Professor Borba said, the skill will one day come there, and we don't have to worry about that. But as to be a good surgeon, a good person, to have a good heart, as Professor Kato has shown us, that's the difficult part. I don't know if Ahmed has any comments, any questions.
I would like just to thank all of professors. I mean, Professor Yoko Kato, Professor Luis Barba, and of course you, Professor Byron, for the kind words and for the informative and really inspiring lecture from Professor Yoko Kato. As a young neurosurgeon and the next generation of neurosurgeons, that was inspiring us and push us to work much more and to be good as much as we can. So I'm so grateful for being with us, Professor Ikukato, and I'm thankful for Professor Baron Salazar and, of course, Luis Barba for giving me this opportunity to be part of Young Neurosurgeons Committee. Thank you so much for you all, and I will let others to get their opportunity to ask anything.
Thank you, Ahmed. Jose Valerio, I know a few years ago you were one of the young neurosurgeons. I guess you're still out in the heart. How would you tell us your experience, this change of becoming from a young neurosurgeon to becoming one of the seniors neurosurgeon with all the experience? You are reaching success. You're operating. Anytime we see you, you are in the OR. So, how is that? Turning point for you? How was this for you?
Okay, so I want to say something. You hear me well, correct?
Yeah.
Okay, so there's a statement that said the world is flat. I don't know if you guys can hear that, but with the advances of technology and communication, so there is no reason why to miss time on communication. Now you can communicate in seconds, correct? Compared to when we were using letters. So that's why networking is so important. So with this World Federation of Neurosurgeons, Surgeons, the networking that we are building around the world, giving opportunities to all the young neurosurgeons to find their passion. We were discussing today in the morning with Dr. Borba that the reason why each individual of us try to advance in their field is depend of the passion that the young generations do to try to get to that goal. As a as you know, yes, I was one of the founders of the young neurosurgeon from Latin America, and I have in that time the obligation to find the leaderships of neurosurgery in my time to build the chapter of young neurosurgeon of Latin America. And now all those young neurosurgeons are big shots, are big leaders right now around the flag at least. Uh, Borba, Alvaro Campero, Juan Luis Gomez Amador, etc., etc., etc. And well, one common thing that we were having as a group were the passion that we were bringing to our field. Uh, and I think that's what really make the trick. If you're passionate of what you do, there's no limit for you to succeed. You just need to be consistent. The secret of success is how consistent you are to try to keep your goal on. If it's not going to happen in 2026, but probably it's going to happen in 2030, yeah, or 2028. You just need to keep the finger in the place and continue going. Uh, I think that is the best advice that I can do. My professional career has been going like everybody with ups and downs, and but I have been constant in my goals to try to get what I need to get. Nothing is gonna give us to you for free or as a gift. You need to work and you need to work hard for it. And like Dr. Yoko Kato said, you don't need to be afraid of success. You need to move, take the courage, and go for it. I think that's the best thing that I can tell them.
Thank you, Jose Valerio. I have a question that it was really interesting. It says, for Professor Cato, for Professor Borba, how will I measure my progress in the first year, the third year, the fifth year after graduation? What would you say against that? How will you measure yourself if you are, getting better, if you are getting, the right kind of surgeon in these changes from residency to be on your own? How was maybe this process for you? How you took your progress in the first year, in the third year, in the fifth year?
May I say something?
Yeah. Go ahead, Professor.
You learn in every case, every situation that you are involved. And be humble to admit the failure. Don't leave your ego be eager than you. Your building is growing every day, step by step. Sometimes go down, sometimes go up. Join with good people. Trust in good people. Had your mentor, the guy that is not only a technician, not only a surgeon. This guy is a good man. We need to follow not only the surgeon, we need to follow the guy or the lady or the man that you really trust in the entire life. And you go rows by rows. You forget one rose for one side, one rose for another side. You build your own garden. Sometimes you go to visit somebody to see surgery. You see, nobody is so good that you learn everything from him. Nobody is so bad that you don't learn anything from him. Always you're learning. This is step by step. This is life. Life is like that. Sometimes have flare. You neurosurgery, never give up. If I try to do a clip aneurysm today, I have failure. Maybe tomorrow, I have to wake up in the morning and see, I need to go again. Somebody need my help. And tomorrow be better than today. I believe in so many things in life. Let me tell you what happened to me this last night. I don't know if you believe or not. I operate 7 months ago. A young lady with thalamic glioma, low-grade glioma. I did the surgery. I removed maximum that I could. And I gave radiation therapy, okay? The patient had some clinical complications, some infection, had hydrocephalus. I put a shunt. And the shunt was okay, the patient was okay, but drained just one ventricle, not the lateral ventricle, just one side. And I think I need to fenestrate the septum. And I was planning to do this morning. The last night, you know what's happened with me? I dream. I dream because I was planning to do a third ventricular endoscopic procedure, go to the septum pellucidum, communicate the ventricles. And I dream that I was putting the endoscope. When I put the endoscope, there was a vein, and I damaged the vein and bleed. It's my dream during the night. When I wake up in the morning, say, I not do this procedure. I go transcallosal and communicate it. When I open the callosum, I saw the big vein in front of me. Somebody guide me. Somebody guide me. The night that I was sleeping, somebody guide me. I don't know who. If the guy is up there. And the procedure was very well. I communicated the patient very well, the vein, you see. I believe in this instinct. Sometimes I have to follow something. I don't know, actually, right or not. I should not say that I'm saying this here. But it was in my, see, the experience sometimes give you this knowledge, this wisdom. Maybe if you go to the literature, go to the book, the correct way should go to do a small borehole, put the endoscope and communicate. But somebody told me this. Or the experience. It's time that you learn. Learning step by step with everyone. It's Saturday night here in Brazil, maybe I'm singing different here. Sorry to tell you. Sorry.
No, thank you. Thank you so much, Professor Borman. Maybe has anyone any other questions, any other comments? Professor Aniaku? No?
Yes. Thank you. Thank you so much, Professor Brian. Thank you so much. Yeah, it's my pleasure to thank Professor Yoko Kato for coming around to give us these tips. It's really interesting Learning, always interesting learning from Professor Yoko Kato. Importantly, the surgeon should be human. It makes a whole lot of difference. The surgeon should be humble. And you see that your patient is a fellow human. Again, lifting others that he has been doing over the years. You shouldn't overlook looking back to lift those that you are higher up. Maybe as a senior registrar or as a registrar, you have medical students. See how much you can impact on them. She is a leader, and she has been carrying all the neurosurgeons globally, no exception. And that has always been it's always been great being around Professor Yoko Kato. Well done, Professor Kato. We so much appreciate this presentation. Thank you so much, Brian, for this opportunity to comment in this meeting. I so much appreciate.
Thank you. Thank you, Professor Nyako. I guess that's it. Thank you so much, Professor Kato, for being here with us. We always are very welcome of everything that you do for us, our teachings.
Can I give a minute comment?
Yeah, sure. Thank you. Go ahead.
I am from
Fadil, how are
Indonesia,
you?
Abdul Hafid Bajamal, Professor Kato. Dear friend, dear senior, we have seen this brief presentation which share the experience of someone I have known since my first visit to Fujita in 2019. She's a master, a teacher, who has inspired thousands of neurosurgeons, especially in my country. She is a neurosurgeon who has built a legacy that extends far beyond the operating theater. It is not merely about the word she speaks, simply a dedication that she mentoring young neurosurgeons all over the world. Reveal a true humble individual, Professor Kato. Thank you very much from my heart and from all of my young neurosurgeon of Indonesia. Thank you very much.
Thank you, Professor Jamal. Thank you so much. I also would like to thank Professor Borba for being here with us. We know that Professor Borba is always traveling, is always in webinars teaching. So thank you so much for being up almost at midnight. And Ahmed, thank you so much for the organization, for all the members of the committee, all the chairman also, Sabadell, thank you so much. John, once again, thank you so much for Neurosurgical TV, all your help. It's always amazing how you organize these things. So thank you so much, everybody. I'll see you in the next weeks. We will prepare something else. So thank you so much for being here with us.
Good job.
See you next week in Mumbai.
Thank you.
Yes, of course. Not next week.
Okay.
This week.
Okay, thank you. Bye-bye.
Good night. Good night.
Bye-bye.
Have a good
Thank
sleep.
you.
Bye.
Thank you so much.
Good night.
Bye.
Thank
Byron, thank you so much.
No, thank you, Professor. Thank you so much.
It's a pleasure to work with all you guys.
Oh, yes, John. Thank you. Thank you so much. Thank you, Ahmed. Everything perfect.
Thank you all.
John, and so this, as Professor Barber said, may we have this recording so we can upload it to the WFNS webpage?
Yeah, it's on YouTube. Yep. I'll send you the link.
Perfect. Okay, perfect.
Yeah, it'll be on the front page of the website, and you can just take the web URL from there.
Okay, perfect. Okay, John, thank you so much. Ahmed, thank you so much, everyone. Good night.
Thank you.
Thank you for being here.
Oh, you wouldn't believe. Oh.
Bye-bye, John. You want to say anything else? John, are you there? John? Hello? Hello?
Hey, I'm in.
Yeah, I mean,
Hold on,
yeah,
let me
if
tell
you
you
could
something.
stop recording. John,
Yeah, hold on, I'm trying to get off this. You won't
okay,
believe
bye-bye.
how hard this was.
I have to leave. Do you want to say anything? Bye-bye.
Hold on.
Where?
I'll talk to you tomorrow.